The following program is sponsored by the Medicine Center Pharmacies.
Good morning and welcome to Health Matters, the Medicine Center Pharmacy, a local Health Mart pharmacy. I'm your pharmacist, Paul White, and we're glad you joined us. Before we begin, I'd like to thank our sponsors, Mercy Medical Center, Studio Arts and Glass, and of course our technical producer, J.D. DeAngelis. In the studio with me is Brad White, a compounding pharmacist, our very special guest, Tracey Majors, manager, Mercy Medical Affairs, and Dr. Frank Kaeberlein from Mercy Medicine Center. Sorry, folks, changing in the wording here. Good morning and welcome to the show.
Good morning.
Good morning.
September is Sepsis Awareness Month, and our guests today are here to help raise awareness about this condition. When a person has sepsis, an infection already exists, and sepsis is an extreme response to an infection which sends a flood of chemicals into the bloodstream to fight the threat. However, this causes widespread inflammation and over time can cause long-term damage to the body. According to the Sepsis Alliance, sepsis has been named the most expensive inpatient cost to American hospitals, and in 2014 alone, it averaged more than $18,000 per hospital stay. We'd like to remind our listeners today that the program is available on our podcast, which can be downloaded from the App Store on your favorite mobile phone. Look for the Health Matters with the Medicine Center Pharmacy, and you can listen to any of our programs anytime. If you have questions you'd like addressed today, you can post them up on our live Facebook feed, or you can give us a call at the radio station at 330-450-1480.
So, Doctor, tell us a little bit about yourself and your role at Mercy Medical Center.
Sure. I'm an emergency medicine physician. I joined the staff at Mercy in 1992. I became chairman of the emergency department in approximately 2000. And I also chair our sepsis committee at the hospital, which is why I'm here today to talk about this.
And Tracey, tell us a little bit about yourself and your role at Mercy Medical Center.
Sure. I'm the Director of Medical Staff Quality at Mercy. I've been at Mercy 26 years.
Wow.
And I've also been involved with our sepsis committee and our sepsis campaign.
Close to 50 years. Is that about right?
Sounds about right.
That's pretty amazing. So, for our listeners who might not know, what is sepsis?
Well, sepsis is really the way your body responds to an infection. Now, not all sepsis starts with an infection, but not all infections lead to sepsis. That's important to understand. And so when I work in the ED, I will often tell my patients that, I'll use an example, let's say you have a cut and you develop an infection like on your arm. That infection is called cellulitis. It's very common. And in most people, you treat that with some antibiotics and you get better relatively quickly. If that infection becomes more severe, or perhaps the patient is immunocompromised, maybe they're a diabetic or they're on some kind of drug medications that make them less able to fight off infections, that infection can spread, and your body then tries to respond to that infection, and that response is what causes sepsis. Your body releases these chemicals, and that response of your body is what creates that whole sepsis issue.
So sepsis is not an infection, or?
Sepsis always starts with an infection, but it really is the response of your body to that infection.
Run that by me again now, what sepsis is, okay? I guess what I'm thinking, and what I've always thought about it was another infection accompanying one you already had.
Not exactly. Sepsis is really, the best way to describe it is, if you have an infection, it's how your body responds to that infection. And the body's response is to release these chemicals into the bloodstream, and those chemicals create almost an inflammatory process in your body. And that inflammatory process, that's the sepsis process. So all sepsis starts with an infection, but not all infections lead to sepsis.
So how does the person's body react to that? I mean, what happens to the person?
Sure. When you try to fight off these infections, these chemicals are released, and they create inflammation in various organs, your brain, your lungs, your kidneys. And that inflammatory process is the septic process. And that inflammation can lead to ultimately decreased blood flow of these various organs, your brain, your lungs, your kidneys, and these organs can then shut down.
I see. Okay.
And that's what people talk about, a total body shutdown or organ system failure. That's what that is. And in severe cases, people will drop their blood pressures. That's called hypotension, and that's called septic shock. Sepsis is a range of things, but the most severe part of it is called septic shock, where you have a very low blood pressure and you can no longer provide enough blood to your vital organs.
Oh, I see. Okay. Very good.
Okay, how prevalent is sepsis, and how many people are affected by it?
Sepsis is very common. Obviously, we have national. Tracey will talk about these. We have Sepsis Alliance now and national campaigns on sepsis. In America, sepsis affects about 1 million people annually, and about 250,000 of those will actually die from sepsis. So it's a very common problem with a very high mortality rate.
So if we got a cut or we got an infection or something, it's always necessary to have immediate care. I guess. I mean, you can't go for a scratch to the hospital for everything, that sort of stuff.
Right.
But there seems to be a wide range of. What am I trying to get to there? A wide range of
causes,
things that happen to you, on and on.
Right. I think that points out. I mean, obviously, let's say you have a cut. The first thing you want to do is just basic first aid. You want to clean that cut so it doesn't become infected. But if it does become infected, then you do want to see some kind of doctor sooner rather than later. And you don't want to wait until you develop sepsis. But at that point in time, you'll probably end up in the hospital emergency department.
Okay.
So you really want to treat any kind of potential sources of infection, or if you develop urinary infections or things like that, you want to treat those early and don't wait, because the longer you wait, the more likely it is for that infection to lead to sepsis.
I see. Okay.
And I think for public awareness, what the websites that you mentioned, Surviving Sepsis Campaign, the National Sepsis Alliance, those websites will definitely tell you if you have a cut, the cleanliness, the cleaning it, taking care of it, keeping it protected from getting dirty. They will talk about hygiene a lot, hand hygiene especially, clean hands, as a protection and a prevention of sepsis.
Well, I guess I've never heard a lot of dialogue about this and conversation about that until maybe recently. Is that accurate, or?
I think that is accurate. It seems to be on the websites. It talks about probably 2004 when they started looking at this in detail. It was about 2015 when we at Mercy began to really measure and monitor and look at the data and look at the patient charts to see what the awareness is and what our really, it was a mortality rate we were looking at. They also, the Surviving Sepsis Campaign came out with bundles of care, and that's what we first originally started following. They have a 3-hour bundle of care. Most important, it was fluids, antibiotics, and then vasopressors to help the blood pressure. And then there's a 6-hour bundle once you get through the first 3 hours. So when we started looking at that data, we also belong to the Ohio Hospital Association, the Northeast Ohio Quality Collaborative, and that's a group of hospitals looking at sepsis and public awareness. And our data statewide, they wanted a mortality rate below about 15%, and ours currently is about 9%. So we've really, with the bundle initiation and getting our emergency department physicians on board, we've gotten our ICU physicians on board to follow these bundles, because therefore the patients who are severe sepsis, septic shock. So when that happens, those patients are going to the intensive care unit. So when we developed those bundles, we followed them, we monitored them, we've seen a decrease in our mortality rate. The other thing that we've done at Mercy is we have, if patients are on the floor, 80% come through the emergency room, but we have identified about 20% are becoming septic on the floor. So like Dr. Kaeberlein explained, the infection and the organ inflammation might progress and that sepsis response. So our rapid response team, when the nurses are noticing that there is a decline in the vital signs or a mentation change, they can call a rapid response, have more people eyeball the patient, look at the patient, and we've built in some order sets to get blood work, to get fluids, call the doctor and say, we think this might be sepsis. And I think that a lot of education has been done to all of our nursing staff, all of our physician staff, and we've put electronic order sets together, the rapid response orders, again, trying to give people the tools they need, because quickly we need to identify it and start treating.
So if I come through your emergency room or any emergency room, if I have an abrasion, an invasion of my skin, bleeding, whatever, I'm suspect for that. Would that be right? Or
yes, if you show up with an infection, for example, in our emergency department, our triage nurses will have some guidelines of how to identify people who present with signs of possible sepsis. So they'll look at things as like your temperature, how fast you're breathing, how fast your heart rate is, because those are actually ways we kind of diagnose sepsis. They then identify those patients as being at higher risk for sepsis. They get flagged when they arrive to the ED. So then the ED physicians are aware there's a patient with potential sepsis there, and we then make them a priority to see them to kind of do our assessment and determine, are they septic or not. And that's one reason I think why we've done so well. We had a very, very nice process down there to really identify patients with potential sepsis very quickly.
Symptoms all the same?
No, and that's why it's hard. It's hard for patients. It's hard for doctors. It's really a spectrum of symptoms. The most common one would be fever, which makes sense.
High fever or just a moderate?
Even a very low temperature can be a problem. You can be hypothermic, but usually it's a fever. They use 101 as kind of the cutoff. But obviously, depending when you measure your temperature, you might get a fever just below 101, and you still be septic. But a fever is the most common thing. And then there's things that go along with that: a high heart rate, a fast breathing rate. And then we often look for things like an altered mental status, where a patient is perhaps more confused than they normally are. Because this is really more than just a simple infection. This is an entire body response to that infection, and that response is what we're seeing with the breathing rate, the heart rate, the fever, and perhaps the confusion.
So there's no blood tests?
There are blood tests.
Okay.
Yes,
all right.
There are. Yeah. Okay. So when you come to the emergency department, we actually do several blood tests. We do typically a CBC, looking for a high white blood cell count, because that's a clue to the diagnosis. And there's also a test called a lactate, which we do also in triage. When you arrive with a potential sepsis patient, we have our nurses draw a lactate in triage. So it's available when I see the patient when they get back into the bed. And that lactate level tends to rise with sepsis also. So we also use that as a major help with us making the diagnosis.
Amazing.
Interesting. Okay. I guess I didn't realize personally that sepsis could be identified by so many visual or observed symptoms with between fever and breathing and confusion level. So that's really interesting. I think that's important for our listeners to understand, because personally, I always thought that sepsis was you found it by a blood test, and you wouldn't know unless you were a medical professional.
Right, and that was kind of the I've been doing this for almost 30 years now. The old way of thinking was you had to have bacteria in your bloodstream. And while it's true that that is definitely going to almost always cause sepsis in most people, we oftentimes never find a positive blood culture.
Has sepsis always been with us?
It has. It has. It's just that we have a much better understanding of what causes it, how to diagnose it, how to treat it, and then also as people are living longer and longer and longer, it's more possible for people to come down with sepsis, of course, because the older you are, you tend to be more prone to infections. You're less immunocompetent, so infections can more rapidly become septic. So we simply see more of that for all those reasons.
How quick can it progress? Is this, if you have an infection, is this like within a day, 3 days? Is that a fair question?
It's a tough question because it depends on a lot of things. It depends on what the source of the infection is. It depends on, are you a young, healthy person, or are you an older individual on cancer drugs that's immunocompromised and have a very low white blood cell count? So it really depends on a combination of things.
Wow. Okay, first break's here. You're listening to Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
It's that time of year again. It's time to protect your family against the flu virus. Hi, this is your pharmacist, Brad White from the Medicine Center Pharmacy. Flu vaccination should be a priority to you and your family, so take the steps today to protect yourself. Visit any of our Medicine Center pharmacies and get your flu shot. And don't forget to stock up on items to boost your immune system like probiotics and multivitamins. The Medicine Center pharmacies are conveniently located in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
Medicine Center Pharmacy was named the 2018 Best of the Best Pharmacy. And we'd like to thank our customers and our staff for the honor. Our 13 pharmacists in Canton, Louisville, Minerva, and New Philadelphia help keep you healthy and save money. From free kids' vitamins to compounded prescriptions and affordable diabetes care. Ask how we can help. And don't forget, we have free screenings at our pharmacies on Tuesdays. Call 330-454-8772 for more information or visit medshoprx.com. medshoprx.com. Welcome back to Health Matters with the Medicine Center Pharmacy. Today we're discussing sepsis with Mercy Medical Center's Dr. Frank Kaeberlein and Tracey Majors, Manager, Mercy Medical Affairs. September is Sepsis Awareness Month. I have a question posted on our live Facebook feed. So we've been talking about this kind of off camera too. Are sepsis symptoms hard to distinguish from other illnesses such as flu and whatever?
Yeah, they definitely can be, and that's why it's so hard for patients and for doctors too. Obviously, it's very easy if someone shows up to the emergency department and they have a fever and they have a low blood pressure. That's usually going to be sepsis or septic shock. Mm-hmm. Those cases are kind of easy to diagnose when we see those. But there are a lot of other people who present with far more subtle symptoms. And the symptoms, can be the same as with other conditions that are more benign. Obviously, with flu, you get a fever too. But most people with flu don't develop sepsis or septic shock. So it can be extremely difficult, and it takes sometimes some testing in the emergency department, and sometimes how people respond to some of our therapies down there to get a sense of, is this something more simple, like influenza or simple cellulitis, or is this someone who's actually septic?
Can you give us the percentages again of the patients, whatever, who come down with this or have this when they come in, or do you have those numbers? Well,
like I said, the national figures are across America. About 1 million people a year are diagnosed with sepsis or septic shock, severe sepsis, septic shock, and of those, about 250,000 will actually die from that.
Mm-hmm.
Wow!
So we're doing a better job, kind of finding it and fixing it up before it goes too far.
That's right. Yeah, there's been a big push, obviously, recently to be far more aggressive about finding patients with sepsis when they arrive to the emergency department. Because if you wait and you don't diagnose this until the next day, that's often too late. Mm-hmm.
So I'm just thinking obstacles for you, especially after my wife had me watch Grey's Anatomy last night, and I'm never going to that hospital. Anyway, but I'm thinking about all the challenges you have when a patient comes in. So you have a patient who's never feeling well. They probably waited too long to come see you at the ER. And then you have to kind of get a whole bunch of symptoms and history from a person who doesn't feel well and probably isn't maybe always capable of telling you what's going on. So that's got to be a real challenge.
It is, and we deal with that all the time. Obviously, it's harder in someone who perhaps is an older individual from a nursing home who has, let's say, some dementia. They can provide very limited history, so you have to review some of the nursing home notes, maybe talk with some family members or the EMS squad that transported them in. But that is why it's so challenging in some situations.
Okay, so what about antibiotic resistance infections that could lead to sepsis? Okay. It's all we hear is, we've had too many antibiotics. We've given the children too many antibiotics. Don't give them antibiotics for the flu, all this kind of stuff. So where are we at here?
Well, obviously, you want to reserve antibiotics for people with bacterial infections. That makes sense. So they don't treat viruses, which is the most common source of fever, actually, in most people. So you want to reserve those for bacterial infections. And the issue happens that if you have people who develop, antibiotic resistance, those bacteria don't respond to what you would normally give. And so you might initiate an antibiotic for an infection that you think this would be the appropriate drug to use. But if they are resistant, that infection just will not be treated appropriately. And then the longer that infection goes on, not properly treated, the more likely they are to develop sepsis. So that just makes things worse. It makes it a little bit tougher.
Wow, okay. All right, we talked about this, I think, a little bit earlier, but how do we diagnose this thing, sepsis?
Right now, there really is a kind of a CMS, which is the Centers for Medicare Services, has kind of a very formal diagnosis definition for sepsis in the emergency department. They rely on kind of four factors. One is that your temperature. Do you have a fever of greater than 101? One is what your white blood cell count is, which is a blood test. Is it above a certain value? Yeah. And do you have a heart rate above 90 and a breathing rate greater than 20? If you have two of those four things, plus a concern for infection, then you're considered to have sepsis. Yeah. And then once you have that concern, sepsis, is a spectrum of illnesses also. You have very simple sepsis, which are patients that have normal vital signs for the most part and look generally well, to people who have severe sepsis, where they're starting to show some signs of their organs not being appropriately perfused with blood, for example, as the inflammation gets worse. Then you have septic shock patients, which is the extreme, where patients actually cannot maintain their blood pressures and they have low blood pressures, and that's called septic shock.
So for the audience, a high white cell count means that there's something going on in your body, okay, and a low white cell count means that you're unable to different type of response. You're not able to respond to infection, or
yeah, it's somewhat. Okay. White cell counts have a range. And a high white blood cell count usually is associated with infection or inflammation of some type. But some people can have actually very low white blood cell counts if they're on certain cancer drugs, for example, and that makes it very hard for them to fight off infections. So you can have a low white blood cell count and have sepsis also.
Okay. Excellent. Bottom of the hour, time for the news. Thanks for joining us this morning on Health Matters with the Medicine Center Pharmacy.
You're listening to Health Matters with the Medicine Center Pharmacy and your hosts, pharmacists Paul White and Brad White. Remember, you can get more information right now by visiting medshoprx.com. That's medshop.rx.com. We'll be back with more of Health Matters with the Medicine Center Pharmacy in just a moment.
We understand the one-size-fits-all approach doesn't always work. We do customized compounded medications based on your doctor's prescription to match your specific needs. Hi, I'm your pharmacist, Brad White, from the Medicine Center Pharmacy. Do you use or need customized compounded prescription medications because of allergies, special formulations, or need an easier way to take your medication that isn't available? Many physicians choose to prescribe a medication that is not commercially made and requires a pharmacy like ours with special equipment and training to prepare a capsule, suspension, cream, or tablet. Are you sensitive to lactose, dyes, or need a sugar-free suspension? The Medicine Center Pharmacy is here to help you. Every day we prepare custom medications for infants, adults, and pets in our PCAB accredited compounding lab. Call or stop by the Medicine Center Pharmacy today at 551 West High Avenue in New Philadelphia, where wellness begins.
Have you seen the latest inventory in the Half Off and Hot Buy store in Louisville? 2 new shipments have arrived to the store, and they include everything from EOS body lotions to home decor and lighting. We have a huge selection of fans in several colors, one for every room. Lots of Halloween costumes for babies, little kids, and adults, and Halloween decor. Yes, Halloween is just around the corner. We'll find cots, luggage, household items like blinds, accent furniture pieces, dirt devils, and much, much more. Come see us at the Louisville Half Off and Hot Buy store next to the Medicine Center Pharmacy.
Brighten your day with beautiful stained glass from Studio Arts and Glass. Let the sun shine in through a stunning beveled glass window that forms a rainbow on your walls. Commission a piece of art to cherish for years. All at Studio Arts and Glass on Apple Grove and 77 in North Canton. Open Monday through Saturday, 10 to 6, or shop online at studioartsandglass.com. That's studioartsandglass.com.
It's that time of year again. It's time to protect your family against the flu virus. Hi, this is your pharmacist, Brad White from the Medicine Center Pharmacy. Flu vaccination should be a priority to you and your family, so take the steps today to protect yourself. Visit any of our Medicine Center pharmacies and get your flu shot. And don't forget to stock up on items to boost your immune system, like probiotics and multivitamins. The Medicine Center pharmacies are conveniently located in Canton, Louisville, Minerva, and New Philadelphia, where wellness begins.
You're listening to Health Matters with the Medicine Center Pharmacy. I'm your host and pharmacist, Paul White. Today we're talking about sepsis with Mercy Medical Center's Dr. Frank Kaeberlein. Am I right, Dr. Kaeberlein? Am I doing okay?
You are.
Okay. And Tracey Majors, Manager, Mercy Medical Affairs. September is Sepsis Awareness Month. We've got a lot more to cover this morning, so let's get back to the show.
All right, before the break, you were telling us about, like with many medical conditions, there are different degrees of sepsis. And I'm thinking about patients who are maybe delaying going to seek medical care because they're tough and they think they're going to be okay. Can we talk about what one of their loved ones or a caregiver might be looking for to see if they can help make sure that if someone needs care, they can get it as soon as possible? Because it does sound like time is of the essence in this condition.
Yes, it is. And I think one thing we would like the listeners to know is the Sepsis Alliance has come out with a new acronym of TIME. So they want to say it's about time, and time meaning T for temperature. So as Dr. Kaeberlein said, either a high temperature, sometimes it's a low temperature. I is for an infection. So if the patient already has an infection going on, then that also should clue you in. A lot of times, though, people don't tell us, or elderly people ignore some signs and symptoms. So we had talked about it could come from a cut that you're observing and watching for redness and swelling, or it could be a urinary tract infection or a cough that you really have pneumonia. So some type of infection. And then for elderly, too, another thing to really pay attention to is the mental status. Are they confused? Are they disoriented? And we know a lot of elderly have dementia, but if, the family members can say, they weren't like that yesterday, or maybe nursing home staff say, this morning they were fine and now all of a sudden they don't know my name. Some of those little subtle changes that you might say, oh, they're elderly, could be a sign that we're looking for and we want people to pay attention to. And then E is someone that is extremely ill, and those are people who might say, I feel like I'm going to die. We shouldn't take those lightly. A lot of time people have a sixth sense. So when you think of the acronym TIME, think of the T for temperature, infection, mental status, and then E if they're extremely ill, maybe it's pain they're feeling, because maybe organs are shutting down by this time, or maybe it's just they feel so bad that they think they're going to die.
So Doctor, you said 101 was kind of the bottom line here? Or?
Well, they use 101 as one of the diagnostic criteria CMS does to define sepsis. But like as Tracey had mentioned, if you come in and you have any kind of fever, even lower grade, we will take that seriously.
Okay. So in an active case of sepsis, would we expect a higher temperature than 101? Or
typically, you would.
Okay.
Yeah, typically, that's kind of why they use 101 as the cutoff.
Okay.
Because lower grade temperatures are perhaps less likely to be part of sepsis, but it's not 100%. So
Okay.
again, you have to take kind of all these things into account. Patient that is, let's say, elderly, who's immunocompromised and a diabetic, even a low-grade temperature will get my attention, whereas a young, healthy person with just a sore throat might even have a higher temperature. I would not be as worried about that patient.
I can remember as a kid, whenever I wasn't feeling good, my mom would get the thermometer out and take that temperature. But I don't think people do that anymore. I mean, do they? Or it's not. It's uncommon, I think. I don't feel good, but.
Yeah, that's an interesting comment because it's true. The older patients tend to still take their temperatures.
Yeah.
Younger patients don't even have thermometers.
Yeah.
And so we often, they have no idea that they had a fever.
I guess I look at all the array of temperature gauges and thermometers that we have on the shelf, in the store, and I think to myself, if you get one of them electronic things and you haven't used them in 2 years, the batteries are no good.
Right, exactly.
You need a conventional thermometer in your house, okay? Right. And they're not expensive.
The old mercury style, right?
Yeah. I mean, really, because...
And then you clean it with alcohol and
you have to
sleeves.
put it away. Yeah, I can't get over the number of people over the years that, I bought this here a couple of years ago and it doesn't work. So, anyway. Where are we at, Brad?
Well, we've talked quite a bit about when a patient presents at the hospital and how you work to identify their signs and symptoms to make sure if they need extra care for sepsis. Is there anything you'd like to add about your process at Mercy? Or, we've talked about your TIME acronym. When is it time to seek medical care and not just assume they're going to be okay and we'll wait till tomorrow?
I think that's difficult to answer because, as Dr. Kaeberlein said, those signs and symptoms can be subtle. They can be over a week. It's, I think one of you mentioned that people tend to sit at home and say, I'll get better tomorrow, or I'll wait and see, or maybe it's Saturday. And so I think that really has to be when the person feels there's a definite change. Or some family member notices a definite change, then I would seek immediate attention. And I know a lot of people, we were telling people seek out your primary care physician first, go to the office, see what they have to say, and then emergency rooms are for those severe patients where you see that mentation's changed, the breathing's changed, and they're hypotensive now, so now you're calling 911 to bring them in. But it is very difficult because a lot of us will sit home and say, I'll just wait and see, maybe it'll be better tomorrow. I'll take some Tylenol, I'll take some Advil, I'll do something to control the symptoms.
Because obviously you don't want every patient with a cold running through the ED. That doesn't make any sense either. I understand that. But sepsis is more than that. You look sicker, you feel sicker, your family will notice that you just don't look right. So if it's just a really severe infection that should be you should be able to pick up with over time.
Now you mentioned earlier about more advanced training. I believe this is the way it came out of the emergency technicians and ambulance drivers and that sort of thing. Can we get them to the point where they can identify what's going on, or do they already? Or
I think one of the ways that we can treat sepsis is to identify it early, right? Because you want to treat patients before they develop severe sepsis or septic shock. You want to get them when they have simple sepsis. And so the more healthcare providers that understand that concept, the better it's going to be, because then the EMS might report, hey, I got a patient with possible sepsis. We would then be aware that's a concern, brought to our attention. The more people that have an awareness of sepsis, that's really what this is all about. One reason I think that we do well at Mercy is that in the ED, we are all very much aware of sepsis. Everybody's kind of tuned into that diagnosis. So when you come in with a fever and a concern for sepsis, we get these blood tests sent off. They get brought back quickly to be seen by a physician. And so that early awareness is really key to diagnosing this.
So what about an early protocol for the technicians, EMT technicians? Okay, they call in, or I'm assuming I'm looking at a TV program. Okay, they call into the hospital and radio in, and the technician's thinking, maybe the technician doesn't even identify it at all, and so the emergency people in the hospital say, "Look, start some fluids." Would that make sense? Is that?
It can, because right now the initial push for sepsis treatment was on patients who are already at the hospital, ones who come to the emergency department, which is probably 3/4 of them, 80% of them, makes sense. The other 20% or 25% are patients that are already in the hospital for some other reason. But then the next area of potential research is, can we use the EMS systems to identify people even earlier?
Yeah.
I don't have the answer to that right yet. Right now about what the best way is to do that.
Well, and I do know the state of Ohio, because through the Ohio Hospital Association, all of the different collaboratives in Ohio have been looking at that, and some of the areas are doing better than others, and getting the EMS on board. The way they've identified it is they've said, look what we've done for chest pain. We've identified chest pain. We get the EKG, give them the nitro. We get them going before they hit the door of the emergency room. So they're pushing this campaign to the EMS provider and saying the same thing. Pick up on the time, pick up on these signs and symptoms, start the fluids, call in, get maybe an antibiotic started, see if you can do something en route. That will help, again, the first, quick as possible.
Yeah, and Tracey alluded to those two facts, that the two main things that help septic patients are lots of fluids and early antibiotics.
Okay.
And so, to get those things on board, you have to look for patients with sepsis to start those two interventions.
Okay.
So it's early aggressive IV fluids and then appropriate and early antibiotics.
But they've had success around the state with EMS engagement, so it is starting.
Okay.
I was thinking about the heart analogy that you gave, because it seems like it's all about education. So the more education and the more you can make yourself aware, and the parties aware, you can hopefully corral these problems and hopefully address them before they get started.
And I know at Mercy, our EMS liaison has worked with our local EMS and talked about signs and symptoms and what they can do too.
I come from an era where there were no emergency vehicles. I mean, you called the funeral home and they took you to a situation that happened to me. I was about 12 or 13 years old. This neighbor boy stuck his arm through a glass window and he had an artery pumping out the blood, and we didn't really know what to do. We had him in the car. My mother did want to take the hospital. This didn't work, and he took my belt off, and I had read something, and I was really quite young. I had read something and closed off the artery and that sort of thing.
Made a tourniquet.
Yeah, I made a tourniquet, and so we finally called the funeral home in North Canton, and they came and took him to the hospital. But we didn't have anything like this that we have today.
The most early ambulances were, in fact, funeral home hearses.
Yeah, for sure. So I'll never forget that day. But okay, so you're looking inside of an ambulance, fire department, whatever. How many people are in the back? Okay, you got somebody driving, okay, obviously, but do you have two people normally in the back?
Yes.
And so we can handle the trauma, okay, and the other person maybe could handle looking for the sepsis or symptom or talking to somebody on the phone. I don't know. Is that about the way it works?
Yeah.
Okay. Oh, gosh. Final breaks here. You're listening to Health Matters with the Medicine Center Pharmacy. Have you seen the latest inventory in the Half Off and Hot Buy store in Louisville? 2 new shipments have arrived at the store, and they include everything from EOS body lotions to home decor and lighting. We have a huge selection of fans in several colors, one for every room. Lots of Halloween costumes for babies, little kids, and adults, and Halloween decor. Yes, Halloween is just around the corner. We'll find cots, luggage, household items like blinds, accent furniture pieces, dirt devils, and much, much more. Come see us at the Louisville Half Off and Hot Buy store next to the Medicine Center Pharmacy.
The warmer weather is here. Hi, this is Brad White from the Medicine Center Pharmacy. Perhaps you've gotten the urge to venture outside and clean up the garage or do some yard work, resulting in muscle aches and pains. If you have sore muscles or aching joints, you may want to consider a prescription pain-relieving cream available with a prescription at the Medicine Center Pharmacy. Our pharmacist can work with you and your physician to get topical pain creams that can be rubbed directly on the source, reducing inflammation and pain. Topical creams avoid troublesome side effects and dependency issues that can be caused by oral medications. The Medicine Center Pharmacy has an accredited compounding laboratory, and it is your source for custom medications. Custom compounded pain-relieving creams, available only at the Medicine Center Pharmacy, where wellness begins. Visit us at medshoprx.com for the pharmacy nearest you. That's medshoprx.com.
With a heart attack, every second counts. Every moment the blood supply to your heart is cut off or reduced leads to heart damage or death. Mercy Medical Center can stop a heart attack in record time. Mercy is the only hospital in the nation that can open a blocked artery right in the ER just minutes after arrival, saving lives and preventing further heart muscle damage. That's because Mercy's Emergency Chest Pain Center was America's first to achieve full accreditation and the first to install a fully functional cardiac catheterization lab just a few steps away from our ER doors. The average time in the U.S. from ER arrival to opening of a blocked heart artery is 64 minutes. At Mercy, thanks to our ER cath lab and the area's most experienced emergency heart care team, it's faster. We're capable of opening a blocked artery in as little as 5 minutes. If you have heart attack symptoms, get to Mercy. We can stop a heart attack in record time. To learn more, visit cantonmercy.org/heart.
Welcome back to Health Matters with the Medicine Center Pharmacy. I'm your pharmacist, Paul White. Today we're discussing sepsis with Mercy Medical Center's Dr. Frank Kaeberlein and Tracey Majors, Manager, Mercy Medical Affairs. September is Sepsis Awareness Month. Let's get back to the last segment of the show.
Okay, Tracy's going to try to give us a summary of our program today to help our listeners understand more about sepsis, how to identify it, and resources to get more education.
Thank you. Some of the research that continues has been from the Society of Critical Care Medicine and the American College of Emergency Physicians. They are currently working on looking at a 1-hour guide, where currently we have a 3 and a 6 hour, so they're looking at even making it quicker in identification and a treatment process. As we want our listeners to know today is remember the acronym TIME. T is for temperature, either a high temperature or a low temperature. I is for infection, some type of infection you might have going on, whether it be a cut, a cough, pneumonia, a urinary tract infection. And then that mental status, especially in elderly, it might be a little bit more difficult to identify, but if there's a little more confusion or disorientation, or they can't remember their name or your name, that might be the subtle symptom that might clue us into sepsis. And then E stands for that extremely ill patient, the one that might be saying they're having a lot of pain, that they just don't feel right, it's something different, they can't put their finger on it, or maybe they're saying, I feel like I'm going to die. So remember the acronym TIME as you are taking care of yourself and your loved ones, and to get to a physician. If you want some more information, you can go to cantonmercy.org, and Mercy has information on their website for sepsis. There is also the National Sepsis Alliance and also the Surviving Sepsis Campaign. This is very much in the public domain right now, making people aware. Sepsis the awareness is September Sepsis Awareness Month. And I know one of our nurses, we were doing some promotions in our lobby, and she came back and said that one of the things, either people did not know what sepsis was, or they knew of a loved one or a friend or family member who had either had sepsis or died of sepsis. So I think we're really pushing this awareness during September and trying to get people aware of signs and symptoms and when to seek medical attention.
Yeah, and if you see your doctor, just ask them, do you think I could have sepsis or my loved one could have sepsis? Just ask that question, The answer might be no, which is okay, but you want that at least to be part of the thinking process.
So would we say that the vast majority of physicians can easily recognize this?
I think that the vast majority of physicians are aware of this now.
Okay.
I think that it can be hard sometimes. I think in an office setting, perhaps, because you don't have that rapid testing availability that we have in the emergency department.
Sure.
But I think that they should be aware of that.
You know, when you go to the physician anymore, the time is kind of monitored, and not like 30, 40 years ago where you could sit there and talk for half an hour, about this and about that. So,
and I know also when I do new physician orientation, and I go over sepsis guidelines with them, especially what we have at Mercy and the order sets, most of them have all been aware, even if they're newly out of school or they've been practicing for a while.
I see. Very interesting. Go ahead, Brad.
Well, I was just going to say, if our listeners want more information, you gave some resources on Mercy's website. Is there other... You mentioned there's going to be activities in the lobby this month for Sepsis Awareness Month. So I guess I just hope that if you have questions that you'll ask, don't be afraid to ask your pharmacist about sepsis, and we can try to get you to these resources that Tracey and Dr. Kaeberlein have mentioned today. Anything else in summary that you'd like to add before we...
How about research, on sepsis? I mean, do we have a national organization, and is it being funded by the U.S. government or drug companies, or where are we at here?
I don't know who's funding it, but there is research going on. As I said, the
money's coming from somewhere.
Yeah, it's coming from somewhere. The Society of Critical Care Medicine continues to look at it because, again, those septic shock patients are going to be in the intensive care unit. And the American College of Emergency Physicians, because as Dr. Kaeberlein said, 80% of the patients are showing up through the emergency department. So that awareness and ongoing research of what can transpire as to the bundles, what we're learning, what things we can change and do. So those are continuing. And then the public awareness is coming through the Surviving Sepsis campaign, the National Sepsis Alliance. There's all kinds of videos of people who, public people and personalities and all kinds of people are putting out campaigns, and a lot of conferences are having patients who are survived sepsis. So you're seeing, I picked up People magazine the other day, and there was an article of a couple who were on the campaign for sepsis because their son who had a cut died of sepsis.
Okay.
Wow. Okay.
Yeah,
So go ahead.
Yeah, and this is this is obviously an area of very active research. As time has gone on, we've discovered what is more important. We discovered fluids really matter, antibiotics really matter early, and as more research is done, we'll hopefully kind of fine tune those even more. And like Tracey had mentioned, we currently have a 3-hour bundle, which means that there's these certain things we want to do in 3 hours when patients arrive with sepsis. Now they're talking about perhaps a 1-hour bundle, to kind of make that time even a little quicker, because sepsis is so time sensitive when you're trying to treat it.
Okay, so you said 80% come through the emergency room.
That we identify at Mercy.
That you identify. What happens to the 20%?
The 20% are the patients who are already there and are in our hospital for some other condition maybe, and then slip into sepsis. So, they have another infection going on, and now, you have the signs of sepsis.
Oh, interesting question. What is the difference between C. diff and sepsis?
Sure. Well, C. diff is a type of infection of your intestines where you get a lot of diarrhea. Sepsis is, again, a response to an infection. So patients with C. diff can become septic from the C. diff, but not all patients with C. diff will develop sepsis.
Oh, my gosh. Okay. That's interesting. The complexity goes on, does it not? Well, we got about 2 minutes left, or maybe a little less. Can you give us some events possibly that are happening during Sepsis Month or anything along that line? Do you have any? I know you said you had a display in the hospital.
We did. We've begun, we've always been providing ongoing education. We had a lot of nursing education via our intranet health streams, and then we've had education to our physician staff. We've had this awareness in the hospital lobby. We have information on our website. So again, just trying to make people aware of what sepsis is and engaging in this month of Sepsis Awareness Month.
People know what heart attacks are now. They know what strokes are.
Yeah, sure.
We want that same kind of awareness of possible sepsis.
Sure. The internet seems to diagnose everything anymore, and I would have expected to see tons of stuff on the internet about sepsis. True, false?
True.
Okay.
It is true. There's
All
a
right.
lot of public awareness and publications out there.
The music is kicking us out of here. So. Okay. Thanks to our guest, Dr. Frank Kaeberlein, and Mercy Medical Center, and Tracey Majors, Manager, Mercy Medical Affairs. We'd like to remind our listeners, if you suspect you have a medical issue, please contact your healthcare provider. Thanks to Mercy Medical Center and Studio Arts and Glass for sponsoring today's program, and of course our technical producer, J.D. DeAngelis. As always, we thank our listeners for joining us on Health Matters with the Medicine Center Pharmacy. We are a local Health Mart pharmacy, caring for you and about you. Have a healthy week, and we'll see you again next Friday right here on News Talk 1480 WHBC.
The preceding program was sponsored by the Medicine Center Pharmacies.